would you like to do a small introduction about you?
Sure, absolutely. And thank you so much for having me, Francis. I am a complementary and alternative medical physician, and regenerative medicine and functional medicine are my forte. And I studied in US and Canada and also in Turkey for a little bit, and I continue my my studies and my training, of course, and Europe, actually, in Czechoslovakia. I got some training also in stem cell therapies. So I do all kinds of alternative therapies using my nutritional science and biochemistry background, as well as a lot of other modalities that complement regenerative medicine and stem cell therapy. So everything from platelet lysate to other platelet type therapies, nutritional IVs and detoxification, and various other modalities that just complement the whole body in the best response and the best results.
Excellent, excellent. So you're talking about stem cells. What are stem cells?
Stem cells are a lower level cell that can regenerate and multiply and divide and become almost any cell in the body. So it can regenerate itself in order to reconstruct damaged tissue, or literally heal disease conditions. And that's why it's so and that's why it's so useful in regenerative medicine and undoing the damage and degeneration caused from aging and disease conditions and injury.
Interesting. So it begs into the next question. I mean, why stem cell therapy?
In today's world and with conventional medicine, it is so common to cover up the symptoms and to basically heal the symptoms without healing the underlying cause or of the disease or the symptoms. And finding the root cause and healing the root cause of a disease condition is what we're trying to do here with regenerative medicine. So instead of just covering up the symptoms with a medication or a painkiller or whatever it might be that is the symptom, we're actually healing the body at its core, stimulating the body to heal itself using your own body and using nature and the best of science and the best of nature in order to get to the root cause of the problem and actually heal the body, which will automatically take care of any symptoms that occur from that disease condition.
So basically, you're allowing your body to actually heal by itself instead of actually trying to get other forms of healers in a way.
Instead of using synthetic and pharmaceutical drugs, we're stimulating the body by using the body to heal itself. Mm-hmm.
Okay. Have you had any pushback from the big pharma in the sense of why you're using this?
I'm going to tell you my experience in the U.S. So I used to practice in Arizona for many years, and we found that the FDA, they have a lot of restrictions on stem cell therapy. So there is a form of stem cell therapy and stem cell treatment in the U.S. and Canada. However, because of the limitations put on by the FDA, which is the pushback from pharmaceutical and big pharma on the FDA, because it's big pharma that funds the FDA, and when there's no drug involved, when there's no drug involved, we're using stem cells from the patient's own body. We're using the patient's own blood to get growth factors and platelets. And then we're using vitamins, minerals, nutritional nutraceuticals and nutritional supplements to adjunctive the therapy, for instance, and oxygen therapy and things like that. There's nothing synthetic. So the pharmaceutical company is not involved in that picture. And so there's no money to be made because everything is coming from the patient's own body. And so that is the reason why FDA is so restrictive, I believe, because they don't allow anything. For instance, a patient needs to be treated within one session. In the US and Canada, the stem cells can't be grown, they can't be multiplied or differentiated, which means they can't be stimulated or activated. And they can't be combined with anything else. The stem cells, for instance, can't be combined with your own blood, for instance, the growth factors from your own blood, which literally can multiply the effectiveness of the therapy so many-fold, but it's not allowed. And so the limitations really are inhibiting results. And for the patient can't get the best possible results. And that's one of the reasons why I left the US to practice stem cell therapy outside of the US. And also we can just do so much more good without those certain limitations.
Okay, I see. So what types of conditions can be treated by stem cells?
Various different conditions. So anything from sports injuries to, if we talk about the musculoskeletal system, so sports injuries and degenerative arthritis, degenerative conditions, neurological conditions, autoimmune diseases like diabetes, multiple sclerosis, rheumatoid arthritis are big ones. Autism is another big one that we treat. Various different diseases, eye conditions, macular degeneration, optic nerve damage, various different diseases, almost anything that will respond to stem cells if done correctly.
Okay, so basically you're getting the stem cell from the patient. Where are you getting the stem cells from?
Very good question. Absolutely. Everything is, we call it autologous. Auto means cell, so it's coming from the patient's own body. In our case, we use adipose-derived stem cells, which are from the fat tissue, the patient's fat tissue. So we perform a mini liposuction procedure. Very non-invasive. It's very quick. It's done within an hour, and it's not even done with it's done with only a local anesthesia. So it's in the area that we remove the fat from, which is usually the love handle area. And most patients love that because almost everybody has excess fat in that area. Sometimes we go in the lower abdomen area or an inner thigh, but that's really rare. We usually get it from the love handle area on both sides.
So besides actually doing the treatment, you also do liposuction as well. So
that's right.
It's 2 for 1.
And in some very specific cases, we may use umbilical cord stem cells also, but I like to stick to the adipose-derived.
Oh, perfect. Great. So why Guatemala or Istanbul in Turkey?
That's a very good question. I alluded to that in one of the last questions in regards to the limitations on stem cell therapy in US and Canada. And so because of those limitations, and like I said, some of the major limitations are the fact that we can't combine the stem cells with other natural factors or antioxidants or growth factors from your blood, like I mentioned, which can make the stem cell therapy so much more effective. So that was one factor. And another factor is that we need to, by law in North America, the stem cells need to be taken out, isolated, and put back into the body within the same session, they say, within the same day. And sometimes that's not feasible because we may need to expand, which means we may need to multiply the stem cells to get a greater numbers, or we want to combine the stem cells, for instance, with other factors to enhance the therapy to make it more effective. And those things we cannot do in North America, in the US and Canada. And it's for that reason we do these therapies outside of Canada, like Guatemala and Istanbul.
Okay, and besides, I think that geolocation is very important as well, because someone from the US can be in Guatemala in 2.5 hours and be back after the session. So it makes it very convenient. Same thing with people from Europe going to Turkey. It also makes it convenient doing that as well. So if I have a condition and I come across your information, why should I choose to go with the STEM Health Institute? I'm sorry.
That's another really good question. What we do at the Stem Cell Healing Institute is we not only do a stem cell therapy and wish you luck and say, okay, thanks, Francis, thanks for coming. I hope the best for you. What we do is we have a very comprehensive regimen of a pre-treatment protocol, the treatment itself, and then post-treatment follow-up and protocol. And that in and of itself is alone at least 3 months. That doesn't mean, that's not to say that you're in Guatemala or Istanbul for 3 months. We only need you there for a couple of weeks. But we start the preparation of your body prior to the treatment, and then we continue it after the treatment. And we do that with various different modalities, like I said. So we use functional medicine. We use the best of nature and science combined to get the best possible results. Functional medicine means that we're using nutritional therapies, food, things like that in almost in a medical way to heal you. To get you prepared. And so we use food a certain way. We use certain nutritional supplements and nutraceuticals a certain way. We do a detoxification of the body when you come, which is not a rigid elimination diet where when you think of a detox, you think of a juice fast or things like that. No, we do a really intense nutritional cocktail, an IV cocktail, and the major antioxidants we utilize in that cocktail, and then we use a suppository to follow that up to get the liver detoxing. And then we also we combine that with certain mineral therapies, which are really important for the stem cells to get them revived and to get them going and to keep regenerating once they're in the body, administered back into the body. And also we use oxygen therapy to rejuvenate the body, to get the stem cells in their most rejuvenated, most active state, and for the body to prepare to receive the stem cells also. And in some cases, we use hormone therapies to prepare the body also. And so we combine so many different modalities, again, using the best of nature and science to stimulate the body to heal itself. And so that's what makes us different from most other clinics around the world, is that we have been specially trained to be able to perform all of these other adjunctive therapies along with the stem cell therapies to have the best possible results.
Interesting. So you mentioned that I don't have to be, or a patient doesn't have to be in Guatemala the whole time. You mentioned that they have a pre-session and post-session. So how long does it take to actually be in Guatemala for the treatment?
For the treatment itself, we like you here about 15 to 17 days. And that allows us to complete the treatment fully. One of the things that that actually adds to that time is if we're using, for instance, hyperbaric chamber therapy, it's much more feasible to do it while you're here. It's less expensive. If you go back to, say, the US or Canada or some other part of the world that you live and continue that type of therapy there, it can cost hundreds of dollars per session. And that's actually, that actually brings me back to your question as to why Guatemala. One of the reasons also that we chose Guatemala is it allows us to perform the therapies at a much lower cost than most other clinics around the world because of just the standard of living, and it allows us to perform the therapies without cutting any corners and without compromising the treatment at all. We can keep our prices down. And so going back to the length of the treatment, hyperbaric chamber therapy, for instance, we can perform that while you're there in that 15 to 17 days. We also use exercise with oxygen therapy, which is another option, and that so that is what actually prolongs the therapy itself, in the number of days that we would need you there. So if you can perform those back at home, you don't need to stay that long. But that's what prolongs the stay so much. And also the fact that we like to just keep tabs for a couple of weeks on our patients and see how it's going, and do that follow-up while they're still here.
So it's an overall treatment. And what will be the results that I will be expecting, or a client or a patient will be expecting after this?
We have seen in 100% of our patients, we have seen some degree of positive results. We have seen patients having results from perhaps this much in a very short time, perhaps this much. It depends on the condition. It depends on the patient and how sick they have been, their age. There are a lot of different factors. We have patients that have come in for simply one treatment and they never needed to come back because one treatment was enough. There are other patients that saw results after one treatment and said, "Hey, Dr. Zahra, I want more. I want to see more. I'm so happy with the results and I want more." And so they may come back after a year for a follow-up treatment. But I can tell you and safely say that 100% of our patients in varying degrees have seen positive results. So we're really happy to report that. And we believe it's just the fact that we have the follow-up. We have all of the adjunctive therapies and modalities that we incorporate into the treatment. And also, I need to also mention that I didn't previously, we ensure that the patient is emotionally and psychologically ready to receive treatment, because we believe that 50% of getting better is attitude and that positive outlook. And if you have that emotional and psychological well-being that we incorporate into the treatment, also that completes the circle. If that's there, we can assure you that you will have positive results, because it's mind over matter. Also, it's such an important factor. So we incorporate all of those modalities in our treatment, which are so important. Because there are some patients, Francis, there are patients sometimes that have been so sick for so long that they don't know how to feel good. They don't know how it feels to feel better. So we prepare them psychologically and emotionally also, and that's really important.
It's really important to actually understand also that it's not just a one treatment thing. I mean, it can be multiple sessions over a period of spans, like you were mentioning. Maybe a year after, you need to come back and do another treatment. And that might be another question of a patient. Do I need to do it just a one-time fix-all, or do I have to do an overall treatment over time?
You know what? We have seen patients, for instance, like an autoimmune condition, we have seen patients with one treatment be in remission, and we haven't seen them come back. And we do follow-up, so we keep tabs on our patients for some time, and they're still going strong. There are times where we see them, and then, for instance, for a degenerative condition, for instance, like a sports injury. Most patients, we just need to see one time. We do injections one time, and they're great. And then maybe from the process of normal wear and tear and aging after years, they want to come back for another treatment. And that's another scenario. For instance, in our autism patients, we see them so young. We have never seen autism patients have to come back. And they just continue to grow and just prosper, and they just go, it's just up from there. And so we've never seen autism patients come back. And so it depends on the disease condition. It depends on the disease. It depends on the age of the patient. It depends on how debilitated they were when they first came in. So it depends, and we never say to a patient that, oh, you need to come back. It's their prerogative, and as to what results they want to see and what they want to achieve. For them, it's very subjective. For some patients, one treatment, hey, I saw the results I want and I'm happy. Other patients, I want to see more, and so it's so many factors are at play.
Yeah, it's amazing how our body is so adaptable and kind of wired to be able to actually heal itself, but we need to actually make those changes and tweaking of the things, the things like you're doing. And when I came across the stem cells, that fascinated me, because I always believe that having a really good diet and having a really good living and now incorporating this is something that you need to do, basically as a maintenance as well. Dr. Zahra, is this treatment, or I know it depends on what the treatment it is, but what's the average cost of a treatment like this?
Really good question. So because we're in Guatemala and in Istanbul, in Guatemala we can keep our prices really fair. We range depending on what we're treating. And the degree of the treatment, what modalities we incorporate in terms of IVs or intrathecal, local injections. Sometimes we do all of them depending on the condition. Sometimes we need a hospital setting, sometimes we don't. It depends on various different factors, but we're looking at an average of somewhere between $18,000 and $22,000 for the treatment, and that includes everything. Doesn't include travel, but it includes everything that we would do at our clinic: pre-treatment, treatment itself, and post-treatment.
Okay, excellent. So for a patient coming from the U.S., the only thing that they have to add into that will be the airfare and probably hospitality. But besides that, I know some of the prices, especially there, skyrocket. Depends on the treatment or the illness that they actually have. Oh, Dr. Zahra, thank you so much.
Sorry,
I think that
Francis.
Yes.
Sorry. I just wanted to add that 18 to 22,000 would be a more degenerative type of disease or condition. We go as low as about 13 to 15 for sports injuries, things like that, that aren't so involved, where we're not doing necessarily an IV, where we don't necessarily need a hospital setting, and so the prices can vary in that way. So I think the highest that we can top it off is at about $22,000 for a more degenerative.
Yeah, and I think that we're going to have another session with you, and next time talking about the different illnesses that you treat. Like right now, we talk about sports injuries, which is a very fairly common thing. Nowadays, we see a lot of sports figures getting injuries because of the turf or because of the requirements that they have. And you also mentioned autism, but I seen your website, and you also have other treatments. And in fact, when I was actually reading stem cells, it basically can cure anything, and that our body actually throws at us. So in our next session, probably a lot of people would like to see it. We will be talking about the different things and more in depth. What will happen, let's say, on the sports injuries, or what will happen on autism, which is becoming more of a mode, and now with children. I saw the statistics: 1 in 4 actually can have, or will have, or do have